I wanted to bring today's episode to the podcast talking about the vaginal microbiome. This is something that we have included in our Fab Fertile method, looking at the microbiome of the vagina. So this can be an important area that may have been missed for you, especially if you're dealing with recurrent miscarriage, with endometriosis. And obviously, if you're on the fertility journey, this is key to look at as well. And also, if you have UTIs, yeast infections, bacterial vaginosis. Those are some clues for us to dig deeper. What is going on with the health of the vagina? Excited for you to listen to today's episode. There's a lot of information about which supplements are right for fertility. And like most couples I speak with, you are probably taking a lot of supplements. But are these supplements optimizing or harming your fertility? That's why we recommend professional grade supplements without harmful dyes, fillers, or top allergens, so that you can prepare your body in the best way for pregnancy. And as you may know, we take a functional approach to fertility. And while supplements are included in your customized protocols, which are based on testing, they are only part of the equation, because there's no pill you can take that will out-supplement the basics, such as poor diet, dysregulated sleep, either moving too much or not enough, and not dealing with chronic stress. So we do recommend basic supplements for both men and women. And these are essential starters that you need to have right now to optimize your preconception health. And I'm excited to offer you a special discount at our Fab Fertile store. You'll receive 15% discount on our professional grade supplements. So simply go to Fab Fertile Store, that's FAB, fertilestore.com, to access the basic supplements so that you can prepare your body for pregnancy success without wasting time and money on supplements that may not be right for you. Go to Fab Fertile Store, that's fabfertilestore.com, and save 15% on your order. I didn't need to go to donor eggs. Obviously, I don't regret it. I have beautiful children. I could have done things differently. I was still cycling back in my 20s. I could have looked at my health, the environmental toxins, the stress I was under.
Many women are being told their eggs are too old. That's an assumption. You can't test egg quality.
Many times it's the man. It's the man who's got a food sensitivity or the zinc deficiency.
There can be a root cause to these quote unquote period problems. The doctor will pass you a pill without any question of why.
Why is IVF the first step? Because we believe it should be the last step. Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone on the fertility journey, and my aim is to help you get pregnant naturally. Today, I'm welcoming Katie Bradbury to the podcast, and we're digging into the vaginal microbiome and why this matters when you're trying to conceive. Katie is part of my team here at Fab Fertile, and she's an integral part of our couples coaching program, which uses functional lab testing, diet, and lifestyle changes to dramatically improve conception. So if you're struggling with fertility, your body is desperately trying to tell you something, and focusing on your health will either help you get pregnant naturally, or if you do need to go to the fertility clinic, it will help improve your chances of success. Katie Bradbury is a registered nurse and nutritional therapist from the UK, whose mission is to improve women's chances of having healthy babies and raising happy children. Having experienced her own struggles with fertility, a traumatic birth, and bonding issues, Katie knows just how important this support is. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Katie, excited to have you on the podcast.
Excited to be here, Sarah. Thank you for inviting me.
Yeah. Can you share with our listeners really how you came to do this work?
So I have a background in health-related fields, and human-related fields generally. So I originally studied biological and social anthropology, and that really got me interested in infant and maternal health in terms of the biophysiology, I guess, of those things in the world we live in today, and how there's a bit of an evolutionary mismatch between kind of what things used to look like and what things look like now. And then from there, I went on and decided to train as a nurse. And you know how things just open up for you and avenues open. And for me, my calling always just seems to have come back to maternal health and like reproductive health and women's health. And so I found myself specializing in gynecology when I trained as a nurse. And Then I went into health visiting, and I don't know whether you guys have health visitors over there, but in the UK, everyone who has a baby gets a health visitor. And so it's like their own public health nurse to come in and talk to them and help them out. So I specialised in that. And then I became really interested in nutrition as well, just like as a side piece, and studied for 3 years in nutrition just for general interest more than anything else. And then all of a sudden, when it came to having my own babies, as I think is often the case with people who end up specialising in fertility, I really struggled. And I'm the kind of person who I'm so maternal, and it was always in my vision, having kids. And I kind of was waiting to the right point in my life, in my career, to have kids. And I finally got to this kind of like really super stable position in life, house, husband, everything else. And it was like, okay, now is the right moment to have kids. And so we were like, okay, we started trying, and then it just didn't happen. And it's like, a month went by, and 2 months went by, and 3 months. And I was like getting really frustrated. Like if I'd have known then how long it was end up going to take in, but it was really frustrating. And it was only once I went through a real journey with that and the psycho-emotional side of everything that I started to, get my clinician's head on a little bit more and focus on what I could be doing to support my own fertility. And it was through doing that and doing the things that we do at Fab Fertile, in terms of all of the aspects of health and well-being, that I ended up falling pregnant naturally, of course, like a week before my first IVF appointment.
Oh, wow.
So, amazingly lucky really that happened. And then I was fortunate to fall pregnant with my second child, like at the click of a finger, like it was practically immaculate conception.
Oh my goodness.
And so now I've got 2 beautiful girls. So, I specialised in fertility in my nutrition practice. I did an additional course with a nutritionist over here, Sandra Greenbank, who is, one of the most prominent nutrition fertility experts in the UK. And then I came and started doing some work with you at Fab Fertile, which is super exciting.
Awesome. Yeah. Well, I'm excited to have you here. And it is interesting, kind of people that end up specializing in this field typically have their own journey with it. They don't want other people to struggle like they did. So it's sort of those, especially you coming from the conventional side of things, and then also like marrying both of that, the conventional side with, the functional and the nutrition side of things, is really that. Because a lot of people think that they have to ignore the conventional side of medicine, and it's not about that. It's really, a lot of times we just go straight to the IVF clinic, straight to the person in the white coat, and we forget about all the other issues going on in our life, diet, lifestyle, stress. But like we're in charge, we're in the center. And so, which is really empowering.
Yeah. And I think that people do often overlook like the whole holistic piece, right? And we're not just a reproductive system. It's, we are a whole collection of systems, and they all interlink. And, I think that there is some people in the medical profession are really progressive in that sense, and then some just aren't. Like I've got a client at the moment who's just been to their primary care practitioner with a bunch of stuff that we've been working on and some test results and stuff, and they've just basically just completely poo-pooed like everything we've been doing. And so, now this poor client is torn between what their doctor is saying and what I'm saying, and it's tough when there is this disagreement, because I think there are things to draw from both worlds.
Absolutely. Yeah. And to trust your intuition on things. It's kind of like, oh, wait a minute. Well, you found this information. To me, once you find this stuff, that's why I've got a podcast on it. You can't look back. Everything you see is seen through a different colored lens now. Kind of like, oh, wait, I can look over here and do other things. And it's not just pills and drugs for the rest of your life. Okay. So as part of our Fab Fertile method, we include testing, and we have food sensitivity testing and hormone testing. We have genetic testing, hair tissue mineral analysis testing, and also the vaginal microbiome, which we are bringing on as part of our method. And this is like freaking cool. I'm like so excited. So Katie's an expert in this, and excited to have her come on and chat with us about it. And first of all, so a lot of us have heard of the microbiome, like there's the gut microbiome, the oral microbiome, there's like all sorts of different, microbiomes in our body. And I've done many podcasts on that. But the vaginal microbiome, what is it and why is it important for someone who's trying to conceive?
Yeah, great question. And, I think you're right. The gut microbiome has rightly got so much research on it now and has really made a name for itself. I don't think there's many people out there now who at least haven't heard of the gut microbiome in relation to health. But the vaginal microbiome, when I first started studying fertility nutrition, I was a bit like, the vaginal microbiome, like, what's that got to do with anything? Is that even a thing? But of course, it is a thing. And as with many things with regards to science and, the fact that science often has to kind of catch up with itself, it used to be believed that the vaginal tract was like relatively sterile. Same with like the placenta, people used to think that the placenta was a relatively sterile place. And we know now that it's not at all. So it's interesting that science often has to kind of catch up. And the vaginal microbiome is a field that is really gaining traction. And over the last sort of decade or so, the scientific community has really started to produce some really great research in this area. And I think we can safely say that we were behind on this field, because this may be a bit controversial, but anything to do with women's health, I find, is often one of the last things to be taken seriously. And even though something like the vaginal microbiome, it actually impacts all humans because it is so important for reproductive health. So previously, I mentioned that I studied anthropology originally, and I was so fascinated at that time to learn about the process of transfer of microorganisms from mother to the baby during birth, so while the baby's passing through the birth canal. So we know that it is really important. And again, like this classic thing of like, we used to think that a baby's microbiota, which is kind of like the individual's blueprint of the microorganisms, was more or less a clean slate at birth. But we now know that it's actually populated by the mother's vaginal microbiome as they pass through, assuming that they do have a vaginal birth. And that can have long-term repercussions for that child in terms of their immune system and other factors for the rest of their life. So it's not just women's health that this is important for, it's everyone. And coming back to why this is important for trying to conceive, it's not just about birth. What we know about that and what we've found out over the last decade or so about the vaginal microbiome is that when it comes to getting pregnant and staying pregnant, whilst your hormones and your thyroid and your immune system and everything else is super important and they all interplay, the terrain really, really matters as well. And so what we're thinking about when we're thinking about the vaginal microbiome is the terrain. And so, of course, we know in terms of the physiology that the vagina is connected to the uterus, and it's the uterus that actually has to home and house a pregnancy. What happens in that lower part of the vagina can impact what happens in the rest of that cavity. So when it comes to getting pregnant and staying pregnant, we have to have those solid foundations in place for everything that's going on the inside to be able to actually thrive. So in terms of the vaginal tract in general, we know that what happens on the outside essentially acts as a barrier. So what we don't want is for nasty pathogens and unwanted bugs and pathogenic bacteria to get in there and then start to wreak havoc. And so what we do want is for this vaginal tract to be an acidic environment that is home ideally to some species of what we would call good bacteria called lactobacillus. And we know that lactobacillus are, some of the good bacteria from the gut as well. The lacto part is key there. And so those lactobacilli, as we call them collectively, then produce lactic acid. And then that is what helps to create this acidic environment in the vagina, which then helps to act as a barrier for some of those. And so if that balance is skewed or goes off, and then the pH rises and we get a higher, less acidic and more alkaline environment, it can give way for some of these other things to come in. And once they're in, it's a lot harder to get rid of them.
Almost seems, because I think we've been taught that alkaline would be better than acidic. Acidic seems like, oh, wait a minute, that doesn't seem good. Can you just talk about that a little bit?
Yeah, and really, really important. Because you're right, a lot of the time people talk about like the alkaline diet, don't they? And like alkalizing everything. But there are certain parts of the body, the stomach, for example, we know that is super important. And the stomach is similar as the vagina insofar as it is an opening to the outside world. It connects with your esophagus. What you're eating goes into your stomach, and what you're eating could be contaminated with anything, and so the stomach helps to get rid of any of those nasties, to help get rid of those pathogens. And it's the same in the vagina. We want that vaginal environment to be not as acidic as the stomach, but certainly on the acidic side, so that it doesn't let those nasties in.
And what are some things that we see connected with if there is an imbalance in the vaginal microbiome? Obviously infertility, but what are some specific conditions that we potentially could see?
Yeah. So what can happen is that once some of these pathogens start creeping in and begin to colonize, they can get quite happy and start to make little homes for themselves called biofilms, and they can be quite hard to shift. And so when that happens, that's when we start to see some of the issues that I often see in fertility clients, like BV, UTIs, thrush. Those are, I guess, kind of uncomplicated-ish symptoms that can be dealt with as they come. But then what can happen as they progress over time, or if they keep coming back, is that they can lead to more complicated conditions. So things like endometritis and inflammation of the uterine tissue, and PID, like pelvic inflammatory disease, Group B strep, which we know has implications for pregnancy. And so all of these can impact fertility in different ways. That's everything from thinking about having patent tubes to actually allow for proper ovulation to happen, making sure that there's adequate endometrial lining, so making sure that that's able to thicken enough for implantation to occur, and also being able to sustain a pregnancy. So the vaginal microbiome can be an important piece of the puzzle for things like miscarriage and preterm birth as well. There's different layers to it, but it's all trouble, really.
And so let's kind of dig into that. So this is something that I struggled with when I share my story. I had yeast infections, and then later urinary tract infections, like bladder infections. I was peeing blood, and I took all kinds of antibiotics. Every time I had an infection, I took an antibiotic. Then I became allergic to all the antibiotics. And then eventually, I found out the connection between diet and lifestyle and was able to then heal that. And then the BV, or the bacterial vaginosis, which I think I had that too. It was like a freaking mess going on down there. And I was just taking antibiotics, which then of course made it all worse. So we see this a lot with the recurrent UTIs, the bacterial vaginosis, the thrush, and yeast. And so that can be some huge clues. Obviously, you want to look at the vaginal microbiome, but also what I found, and we found working with our clients, it's also important to look at the whole body. It's not just looking directly at the vagina. It's also the whole body and how that impacts the body as a whole. Can you talk about that a little bit?
Yeah, so I think absolutely, it is really commonplace to see people who are struggling either to get pregnant or to stay pregnant to have all of those kind of issues that you talked about, the BV, the UTIs, the candida, the thrush. And I guess those things can all interplay because they sit on an axis, right? So, they connect with the gut microbiome. They connect, the bladder is linked to the vagina because they're so, just in terms of their physiology, they're so close together. And so what impacts one can definitely impact another. The whole interplay is so important. So, what you're saying about the rest of the body, what we need to be thinking about is, okay, so we've established that some of these things are there. Why is that actually happening? Is it because in terms of the vagina, is there something going on physically in the vagina? So, for example, we know that the vagina is essentially self-cleaning. And so, lots of the products that are available on the market today, like all of these vaginal products, they can seriously disrupt the balance and the pH down there. And things like douching, and people kind of feeling like they need to massively kind of wash. It is such a delicate environment that anything like that can impact it. And even sperm can change the balance, shift the balance in that microbiome. And we also know, of course, that the vaginal microbiome can shift across both the lifespan in terms of where we're at, in terms of our reproductive years, and also across the menstrual cycle too. So it's not a static thing, it shifts and changes according to what's going on in our bodies at that time. And we know that if our immune system is compromised or, dampened down or subject to inflammation over time through the diet and lifestyle, that can impact things too. And then we've got to be thinking about what those microbes actually like to eat. We know, for example, like the classic example of Candida. Candida loves sugar, like loves it, and loves the refined carbohydrates. And so you often see people have this picture of Candida who have huge sugar cravings, and they feel like they're out of control. And it's like, it's not you that's craving the sugar, it's the bugs, And so you've got to starve them out, like, because otherwise, if you keep feeding them, they're going to grow and it's going to get worse.
And a lot of people do those anti-candida diets. When we're doing a stool test, that a candida or a fungal overgrowth is the last thing that we attack, because otherwise it kind of goes into hiding and then it can bury down deep. And then sort of there's a tiered approach of how we approach those different parasites, bacteria, and fungal. And I think many people have done that anti-candida diet only to have it come back even more in there.
Yeah, definitely. And, Candida in particular is a stubborn one, because unfortunately, for everything that I just described about the acidic environment in the vagina, Candida can actually withstand that acidic environment. So ideally, what we're wanting to happen is not to have it get in there in the first place, because once it's there, it is really tough to get rid of. It's not impossible, but you do need to work through a very careful protocol. You can't just kind of get rid of it just like that. And equally, just as important as considering what feeds the bad microbes is thinking about what feeds the good microbes too. So, we know it's like all the stuff in the gut microbiome. We know that fibers and prebiotic foods, a prebiotic is essentially what the good bacteria like to eat. We do need to be thinking about that. That's how they will interplay, really.
And then what about the hormone piece? So you talked about the menstrual cycle. So how is that, like the relation with estrogen to progesterone, like how is that impacting the vaginal microbiome and sort of the secretions and things like that? What are we seeing there?
This is something that we are still learning about, and what can happen in terms of the estrogen. And what we know is that estrogen and the way it floods into the system at different parts of the menstrual cycle and different parts of the lifespan, it can impact. So, for example, we see like in the follicular phase, we can see an increase in the diversity there. And it's all to do with the lactic acid that is produced by the lactobacilli. Essentially, it's all about the substances that some of these hormones produce and how they feed the bacteria. And so we see these kind of ebbs and flows of diversity. And when I talk about diversity in the vaginal tract, what we're ideally wanting is less diversity. So whilst in the gut, we look for a really nice diverse microbiome, in the vagina, what we want is less. And so we're wanting this lactobacilli dominant environment. I guess another piece of the puzzle there is thinking about just very briefly to touch on the concept of the estrobolome. And so we know that there's a collection of bacteria that are found in our gut that help with that estrogen metabolism, and they produce substances called beta-glucuronidase. And so what we want is for that to be in balance. It's all about balance, really. So we neither want the hormones to be too high nor too low, because the way that they then shift back into the body can impact the vaginal microbiome, and it all sits on this axis.
I would like to invite you and your partner to a Supercharge Your Fertility Discovery Call. This call is for you if you meet at least one of the following criteria. You've been trying to get pregnant for at least 2 years. You've been through at least one failed IUI or IVF. This call is for action takers. If you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. If you're seriously considering work with us, go to fabfertile.com. That's fabfertile.com and click on Apply Here. That's fabfertile, fabfertile.com, and click on Apply Here. Then you'll be booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. So let's talk about transferring infections to a partner. We see that sometimes as well. What are you seeing there?
We do definitely need to be mindful of this. And a common one that I see in the vaginal tract when I do microbiome testing is ureaplasma. Ureaplasma is one that can be passed between partners. Whilst it's not a sexually transmitted disease as such, it can pass quite easily. And so we do often look at treating both partners when something like ureaplasma comes up. But similarly, STIs are really significant here. So, we've spoken so far about things like bacterial vaginosis and candida, etc. But I often get clients who come to me who have had a history of things like chlamydia. And so we really, really want to make sure that they're not lying dormant somewhere and that they have been properly treated. And so in terms of thinking about sexually transmitted infections, then one of the first things I do with my clients is recommend that they have an STI screen just to make sure that they're in the clear.
And then what about lubricants that can help the vaginal microbiome? I actually had one of the founders of Megaspore, and he was talking about the vaginal microbiome. So definitely go back and listen to that episode with Kiran Krishnan. And he was talking about when women, go to get our pelvic swab, we go in there and they're using all that lubricant and things like that to do the swab, which is completely not the best idea for the vaginal microbiome. So, and when you're on the fertility journey, you could be getting a lot of this stuff and all those different lubricants they're using in there. And then also obviously talking about the lubricant that we use during intercourse. So can you talk about that one for us?
Yeah, and I think that is a really important consideration is, often as part of our kind of fertility journeys, the workup investigations, we have all these procedures done, like having lubricant for an internal examination, but also things like having saline solution pumped into your uterus or to clean out your tubes. What can happen in those instances is things like it might clear out some underlying infections that might be going on. But then unless you're addressing the balance and addressing that terrain that I spoke about earlier, then they can come back and they can often come back worse. So we do really want to be making sure that terrain is as healthy as possible in the first instance. But, it is a difficult one. I think in terms of like using the lubricants for vaginal examinations, you've got to think about your own comfort as well. It's just something to be mindful of, the level of exposure to things that your vagina might have. And in terms of for intercourse lubricants, I think that there are some products out there that are meant to be, cleaner and this kind of thing. I'm always still a little bit wary about recommending external lubricants. I do think that the best possible way to lubricate during intercourse is foreplay and get that natural lube going, because that is the healthiest and that is your natural secretions. And so it's not going to be disrupting that balance, because as I said at the, towards the start, even things like seminal fluid, even sperm can disrupt that balance too. So we just need to be careful and give our vaginas a break.
Yeah, because there could be coconut oil or almond oil, but then because coconut oil is antimicrobial, but then there still could be issues with either of those oils as well.
Yeah. Again, like some people in the natural sphere do recommend coconut oil, but I'm always hesitant, to be honest.
Mm-hmm, mm-hmm. Okay, so let's talk about, we've done the vaginal microbiome test and we've discovered that there's an imbalance. What's your kind of line of recommendation and what do you typically see?
What often happens is we might see a build-up of like some of these opportunistic species hanging out in there, like, for example, Prevotella that I mentioned earlier. And what can happen then is, especially if there's more than one species, and I mentioned before that we don't want a huge amount of traffic going on. So when we start to see like a few species creeping in that aren't in the Lactobacilli family, what we want is for them not to continue, ideally, because, as I said, they can create these biofilms. So one of the best ways to do that, in some cases, they might need to be wiped out. And so there is just cause for antimicrobials in some cases, whether that's traditional antibiotics or herbal antimicrobials. But especially in the vaginal tract, I'm always really wary of doing too much wiping out. And I think that doing the building up is just as important. And because these lactobacilli can be quite fragile and quite easily disruptive, it is always really worth it. And so there are a couple of probiotic species that are really well researched for supporting that healthy balance in the vaginal tract. And so one of them is called Lactobacillus rhamnosus. One is called Lactobacillus reuteri.
So there's the Lactobacillus. That was the second word. Can you just say it again for me?
Reuteri.
How do you spell that?
Is one. It's Reuteri, I think, okay, off the top of my head. And rhamnosus is the other one. They always have really elaborate names.
I guess Latin names or something like that.
Yeah, exactly. So those are the two that are the best researched in terms of the vaginal tract specifically. And so there are some really great formulations coming out now that are geared towards especially that. And so what we do know from the research is that those two species in particular, when taken orally, they do withstand the digestive tract and, the acid in the stomach and everything fairly well and get to where they need to go. So that's really great. But what I do often suggest in clients where there is like quite a bit of imbalance, quite a bit of dysbiosis, as we call it, going on, I would recommend then, if they're up for it, is to try some intravaginal probiotics as well. And so it's the exact same tablets, but you have them in your vagina instead. And it just means that they are in the right place and, they dissolve and they're there and they're doing the right thing right from the start.
So how long would that protocol look like if we were doing the vaginal probiotic?
It kind of depends. So if I've got someone who is symptomatic, so if they've got, for example, typical BV symptoms and if they've got a smell and odor going on there, then I would normally do probably 2 weeks. If they've got signs of like an active infection going on, I would normally do 2 weeks of intravaginal and then follow up with 2 to 3 months of oral probiotics to those species. If we're seeing that there is a diversity there that we don't necessarily want to see, but they're not actually displaying any symptoms, which does occur too, I might just go for the oral for a while just to help support that. So it kind of really just depends on what they've got going on there. And another way of kind of giving it almost like an injection of good stuff from the start is to use lactulose solution. So lactulose is something that's often, you might find it in the drugstore to help with constipation. So you can buy it, certainly in the UK, you can buy it off the counter. And so actually using that topically can be helpful because it's the lactose. So it helps to produce that lactic acid kind of environment in the vagina.
Lactulose,
yeah.
Okay. So if you've got some UTIs or BV, then you're going to be, looking at a couple of weeks of the vaginal probiotic and then doing 3 months of probiotics. And we'll talk a little bit more about diet and lifestyle. But what about if it comes back that you have the vaginal candida? Like, what would you do there?
The candida, as I say, is a harder nut to crack. And, you do need to do all the holistic stuff as well. You do need to do all the diet and lifestyle stuff as a real priority. And, that's because, as I say, candida can survive in an acidic environment and it has a really strong cell wall. So it can be very resistant to anything that we throw at it. And glycogen is the fuel for candida. And so that is linked in with our estrogen status. So, we need to be very mindful, and especially in estrogen dominant conditions, we don't just say, oh, hey, this person's got candida, this is what we're going to do for it. It's got to be, thinking about the estrogen, thinking about the diet, thinking about the whole piece, but things to be mindful of when there's candida in place. So things like oral sex can impact it because it can pass between the oral and the vaginal cavities. Things like heavy metal toxicity are really important considerations. There are some supplements that can help. So, for example, like garlic is quite a nice one for helping to shift it. But I wouldn't ever really recommend just putting yourself on a supplement protocol when you've got something like that going on. So I'm always kind of hasten to start recommending protocols before people run out and do it, because it's really important to get a proper assessment from a practitioner before you embark on any protocols like that.
Yeah, I was once recommended, and I've talked about this on the podcast before, garlic, put that in my vagina. So basically I put it in there, but they're like, tie a little string around it and then pop it in. I was like, okay, tied a little string around it, put it in there. And I'm like, oh, crap, that thing got stuck in there. And I'm like, oh my God, what am I going to do? And I have to go to the hospital and get this garlic removed. And I was completely tense, freaking out at the toilet. I'm like, how am I going to get this out? And I managed to just relax. And then it came out. And my husband's like, what were you thinking? Just like tying it. You should have had like a little grommet and put like some little hole in it. He would have like drilled it and had some perfect thing. And I'm like, sorry, my brain didn't think of doing that. So yeah, that was my little experiment with, let's try to put some garlic in my vagina. And yeah, almost, that was a bad one. So
yeah, no, definitely don't recommend.
Don't do that. Yeah. So it is interesting. Even what, we're dealing with low AMH and high FSH and diminished ovarian reserve and premature ovarian insufficiency, but we can still have estrogen dominance with the estrogen in relation to progesterone. And so we don't typically think of those as high estrogen issues, but that could be something that's missed. And also with low AMH, we're seeing many people with endo as well. So definitely things to dig into, is there some hormonal imbalance? And we typically well, obviously we're seeing hormonal imbalance with the couples that we work with. And then we may also recommend bioidentical hormones as well, which then need to be closely monitored. Someone was just asking about this in my Fab Fertile support group. Like it's got to be closely monitored through blood work. And also we can monitor it through the Dutch test as well. So all those things can then be part of the equation. So anything you'd like to say there?
Yeah, I think that absolutely these estrogen dominant conditions are really significant here. And there was a study that showed that people who had stage 3 and 4 endo were found to have higher levels of a species called Gardnerella streptococcus, and I can never pronounce this one, Escherichia, which is like the E. coli genus, and ureaplasma in their vaginal tract. So essentially, people with endo, which is an estrogen dominant condition, were found to have these higher levels of diversity in their vagina and with regards to the pathogenic species. So there's certainly a connection there. And I think there's also lots of space for more research to be done in this area, with specifically around different conditions.
So obviously, as part of our Fab Fertile method, we start you and your partner off by doing an elimination diet. You can check out on the website and the podcast there how and why to do an elimination diet. I run you through the exact steps. And then we have you take out those top allergens, reintroduce them, and then really looking at lifestyle like sleep and movement and some basic supplements. But as far as some recommendations for a healthy vaginal microbiome, what are your diet and lifestyle go-tos?
Yeah, I think the first piece is, as I mentioned earlier, with regards to candida and kind of starving out some of the bad guys is sugar and refined carbohydrates. And, we know that so much of the Western diet now is super heavy on carbs. And that doesn't mean to say go and eradicate all carbs from your diet, because we know that a lot of carbs contain all of that fiber, which feeds the good microbes. So, there is a balance to be had. But in terms of the refined carbohydrates and all of those lovely beige foods that so many of us are addicted to, they are bad news for the microbiome as a whole. And then just thinking, I guess, about the immune system, because when we're thinking about bacteria and being overrun by bacteria as a whole, what we're thinking about is how our immune system responds to that as well. So I often look to the fat-soluble nutrients with regards to the immune system. So vitamins A, D, E, and K, they're all super important for the immune system, and vitamin C too. The best ways to get those ultimately, yes, we can put you on a load of supplements, but the best ways to get those is by eating a diet that is rich in an abundance of plant foods, all the different colours. I don't know what it's like over there, but in the UK, we've got this long-standing public health message, which drives me bonkers, about 5 a day, like your 5 fruit and veg a day. And so I have clients coming to me like, yeah, I kind of struggle to get my 5 a day. And I'm like, you should be having 10 a day, not 5 a day. And you're struggling with that.
Minimum.
So, I think that there's something to be said for just making sure you've got the basics down, making sure that you are basing your diet around all of the different coloured plant foods, but not forgetting the all-important protein and the all-important healthy fats, because they all have a role in modulating your immune system and your hormones too. So, it's really getting that balance right. And, it can be really helpful to work with a practitioner to help you establish the exact balance that is right for you. Because although we can make recommendations on the whole and we all know what it looks like to make steps towards a healthier diet, what you as a person should be doing depends on so many factors. And that's why, at Fab Fertile, we get really involved in all of the testing, because that gives us all of the clues as to what that person as an individual actually needs.
Yeah. And the testing, and people get caught up in this testing because, woo, the testing sounds sexy and fun and let's just figure it out. So the testing is awesome. And that's why we do include it. We have access to it. But it's equally as important to then take action and make these changes. And the basics, like we're talking about, some of these things we already know: fresh fruits and vegetables, don't eat pounds of sugar, cut out alcohol, some of those things. But easier said than done. That's why having a coach to call you out on your own crap literally is hugely beneficial. And so do you have any is there a book or a website, an app, a documentary, anything that you're obsessed with right now that maybe would relate to the vaginal microbiome, or anything maybe just in general that you're obsessed with?
Yeah, I think the vaginal microbiome is a tricky one, because it's so many people in the scientific community right now are it's hot on it with the vaginal microbiome. And it's really, causing quite a stir at the moment, which is great. But there isn't that much stuff out there right now that's kind of accessible to the masses, I wouldn't say. So for me personally, one of my best resources for anything to do with that is one of the labs that we have in the UK here. So In Vivo Healthcare. They've really pioneered a whole microbiome field here in the UK and the vaginal microbiome. And they're really, really excited that soon they're going to be also doing a seminal microbiome test too. So testing the microbiome of the semen, which is like, it's, really, really forward thinking. So they have lots of resources on their website, if anyone wants to have a total geek out and read up on this. But I think ultimately, working with a practitioner is one of the best ways to get info there. And I'm trying to think of resources that I'm like super into at the moment. I think actually one of my favorite books at the moment, which I keep coming back to, which of course it's, you've got to get pregnant to get there. But one of my favorite books is Real Food for Pregnancy.
Is that by Nichols?
Lily Nichols, yeah.
I interviewed her on the podcast. Yep.
Oh, did you really? Oh, fabulous. Yeah, so I really, really love this book because she talks about science, but she also, she talks about things so holistically. And she talks about, I think in pregnancy, there's so much that happens in terms of like recommendations that are spat out at you from the medical world. And it's such an over-medicalized thing. And so, for example, like vitamin A is a super important nutrient for a growing fetus, but it's because of this one study that was done in the 70s or something that showed, it has teratogenic effects, that high dose supplements. Doctors and midwives kind of totally run from it and they're like, avoid. And it's like, no, we need to find the balance there, because yes, okay, really high supplement doses might be detrimental, but that's the same for anything. So, she talks about things in a really real way. And I really like that.
Okay. And is there a success story with the vaginal microbiome that you'd like to share with us?
Yeah, so I wanted to share the story of one of my clients. She's actually I'm waiting to hear from her with her birth story. So she's about to give birth any day now, which is really exciting. And she came to me and she had lots of stuff going on, like this classic kind of estrogen dominance picture. So PCOS, and she hadn't had IVF, but she'd had like a medicated cycle with letrozole, and she just hadn't really responded to that. So nothing really came of it. And she came to me during that and she just wanted, a bit of nutrition advice. So, we started doing a little bit of digging, after we got all the basics down. And what she had was, she did have a history of candida and some itching. She didn't have anything at present in terms of those symptoms, but she did have a little bit the odor going on and, some of those BV symptoms. And so we decided to do the vaginal microbiome testing just to see what was going on there. And sure enough, it was, this picture where there was really actually for her, in terms of the 4 different species of lactobacilli that we can see in the vagina, there were none. So they were all below detectable levels. So essentially the floodgates were open. She was letting anything in. And so we did see for her a buildup of some of these other bacteria. And because she was under a fertility clinic, she did actually take that information to them and they decided to treat her with antibiotics. Meanwhile, we did lots of the work together to really try and boost that up. So, I gave her a protocol, obviously all of the diet and lifestyle piece and the intravaginal probiotics and oral as well. We put her on quite a regimented protocol, and we tested a few months later and things were looking a lot better for her. So for her, it had been a combination of kind of wiping out, but we'd really actively built back up again. And so, it worked out for her and she got pregnant before her cycle of IVF was due. So she was still under the fertility clinic, but thankfully she didn't need to use them in the end. And yeah, she's about to have her baby, which is so exciting.
Awesome. And so do you have any final thoughts on our topic today?
Yeah, I guess just like one tiny little extra piece that we hadn't mentioned is just like with regards to some of these infections going on, that they can be really unpleasant. So if you've got BV symptoms, if you've got candida and thrush, if you've got UTIs, especially recurrent ones, which is often the case, they're really not nice things to have to deal with. And so they can have a really big impact on your mental and emotional health as well as anything. And I guess it was just one extra consideration that I didn't mention earlier, which is that in terms of the holistic view, and, we've talked a lot about the nutrition and a lot about the supplement protocols, etc. But in terms of the stress piece, which, I know I don't need to preach to you about in terms of its importance for fertility, if you're dealing with these constant infections all the time, that's going to have a huge impact on your mental and emotional well-being. And I did see a study that said that I think it was 63% of people who have recurrent UTIs have symptoms of depression because it sucks. And so, and that can play into the mental and emotional well-being, which we know is important for fertility too. So, it is a holistic way of looking at things.
Yeah, that was definitely me. I didn't have depression, but I definitely had like high levels of frustration, irritability, anger, going, what the heck is going on? Like, why? And then literally let's run off to the doctor and get an antibiotic and blow out all my good bacteria. So not until I discovered all the functional approach was I able to heal it. And it's not a perfect thing by any stretch of the imagination, but definitely wasn't the way I was years ago, chained to all these different medications. Now I take many supplements that I potentially can chain to. I go on vacation and I'm like, what? Why am I taking all these bottles with me of supplements? But anyways, it's all good. So
I got searched. I had to do like a search at the airport once because I had so many different pills in like a box. They weren't in their boxes. They were all just like in this dispenser, and they were like, what is all of this?
I know I was going to travel with my collagen powder and just put it in a bag. And I'm like, well, maybe I shouldn't do that. That might be a bad idea. Like, what? And so where can the listeners find you? You're on Instagram and a couple other places. Where can they find you, Katie?
So I'm on Instagram, so at Katie Bradbury Health, so it's Katy, Katie Bradbury Health, and Facebook too. I've got a Facebook group called Fertility in the First 1,000 Days. It's just like a nice little supportive space, really. And I also have my podcast, which is also called Fertility in the First 1,000 Days.
Awesome. Great. Well, thanks for coming on, sharing your words of wisdom on this topic. It was awesome.
Thanks for having me, Sarah.
I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 4 spots available per month to work with us. I would like to invite you and your partner to a Supercharge Your Fertility Discovery Call. And this call is for you if you meet at least one of these criteria. You've been trying to get pregnant for at least 2 years. You've been through at least one failed IUI or IVF. This calls for action takers. If you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. If you're seriously considering working with us, go to FabFertile, F-A-B Fertile, and click on Book a Free Call. That's FabFertile, F-A-B Fertile, and click on Book a Free Call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. You may be taking supplements that instead of optimizing your fertility, may be harming it. That's why we recommend professional grade supplements without harmful dyes, fillers, or top allergens. Simply go to Fab Fertile Store, that's FABFertileStore.com to receive a 15% discount on our basic supplement recommendations for preconception health. That's FabFertileStore.com. The Get Pregnant Naturally podcast, including show notes and links, provides information with respect to healthy living, nutrition, lab testing, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Get Pregnant Naturally podcast reflects the most up-to-date medical research. Information is provided without representation or warranties of any kind. Please consult a qualified physician for medical advice and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.